There is so much energy at this conference. It's like standing inside the heartbeat of Asia's tech innovation scene. Digitalization in the UAE isn't just an upgrade, it's a catalyst. And let's be honest, if my AI dashboard knows a patient is at risk before their symptoms do, that's not just technology, it's transformation. That's a brain for the hospital, and I cannot wait to watch it think. There is so much energy at this conference. It's like standing inside the heartbeat of Asia's tech innovation scene. I'm also curious to see how Chinese companies like FanRuan are pushing the boundaries of data visualization, self-service VI, and smart infrastructure, especially when applied to large systems like hospitals or public health networks. That's a great question and a very real concern. Data deserts mean that most AI models are trained on populations from the US, Europe, and the Western world. When we apply them in the other regions, they can misinterpret local patient patterns, leading to AI hallucinations or wrong predictions. This can cause clinical risk, loss of trust, and even widen health inequities. At Emirates Health Services, we're tackling this by building AI on locally relevant data with the help of trusted partners, ensuring our models are accurate, ethical, and population aware. That's how we make AI truly work for our people, not just on them. Digitalization in the UAE isn't just an upgrade, it's a catalyst. In our journey towards smart healthcare, it turns scattered data into live intelligence, reactive systems into predictive care, and long meetings into real-time dashboards. At Emirates Health Services, digitalization means care is not only faster, it's smarter, safer, and centered on people, not paperwork. And let's be honest, if my AI dashboard knows a patient is at risk before their symptoms do, that's not just technology, it's transformation. We've not just created a digital twin of a hospital, we've created a living, a learning version of it. By bringing in hardware, energy, and environmental data, we go beyond clinical care. We start to see how infrastructure, sustainability, and patients' outcomes are all connected. Imagine this, a system that tells you not just who needs care, but where energy is wasted, which equipment needs maintenance, and how to optimize everything from beds to air conditioning in real time. That's not just a dashboard, that's a brain for the hospital, and I cannot wait to watch it think. In the next 5 years, the AI doctor and the digital twin system will move from concept to clinic. We'll see virtual systems that monitor patients, predict issues, and guide decisions in real time, both inside the hospitals and at home. It's about smarter care, fewer surprises, and giving clinicians and patients more control. And in the UAE, we're not waiting. We're already making it real. Well, my message will be that don't digitize for the sake of technology, but digitize with purpose. Start with your people, stay focused on the outcomes, and choose partners who understand both data and care. Because in healthcare, transformation isn't about systems, it's about trust, timing, and coverage.